Welcome back to the Nature Symphony of Health channel. Sinus issues have been a common problem for many, and often, the go-to solution is surgery. But what if there's a way to avoid that? In today's video, the well-known health educator, author, and speaker, Barbara O'Neill shares her valuable insights on how to naturally relieve and get rid of sinus problems. Stay tuned for expert tips on holistic alternatives that can help you breathe easier, without the need for surgery.
But what we're going to be talking about tonight is respiratory. And this is a big thing with respiratory. So with respiratory, you've got, starting at the top, you've got sinus problems and then sore throats. In fact, I get many mothers saying, what can I do for strep throat? Strep throat. You know what I say? How do you know it's strep throat? You know, we always called it sore throat. Now it's called strep throat, apparently. It's still a sore throat. And then coming down, it could be even just a simple cold, but coming down to bronchitis, tonsillitis, even asthma, pneumonia. These are all problems that are happening in the respiratory. And so where's my why? And there is always a reason. Why do these problems happen? Well, let me begin with the common cold. So in the 1940s in Salisbury, London, the Common Cold Research Unit was set up to find the cause and the cure of the common cold. They would get people, they'd put them in hot baths, then take them out and put them in the cold air. But they didn't get a cold. And then they'd get the people and they'd put them in a hot bath and they'd scrape the throat of someone that had a cold and put that in the person in the hot bath and then put them out in the cold air, and they didn't get a cold. In fact, after 40 years, they closed down in disgrace, really, because of a total inability to find the cause and the cure of the common cold. And they never will, because a cold is a house clean. It's just a house clean. And a friend of mine, his name's Gary Martin, he was the health director at Living Valley Springs Retreat in Australia for many years. He said that he found with a lot of cancer patients there were two common denominators. One, they never get colds. And two, they don't drink water. Now, when you're cleaning your car, what do you use? Water. When you're cleaning your dishes, water. The body, water. So because they weren't getting a regular house clean with daily water, and because they weren't getting regular colds, waste was building up in the body. And the waste build up in the body was a contributing factor to laying the groundwork of cancer. Interesting. So when you have a cold, you know, you're blowing your nose, coughing up, what's all that? It's waste. It's the body getting rid of waste. I mentioned earlier in the week our lymphatic system. And our lymphatic system sweeps away waste from the tissues and it throws the waste into our respiratory. So the largest lymphatic organ is the tonsils, remember that? So I've been struggling with a little bit of a sore throat, so I've been having a lot of garlic and a lot of cayenne pepper, and I must do the running up and down the hills in the morning. Well, that hill near the gorge, you don't have to run. You just walk fast and you get high intensity. Oh, I was so excited this morning. I coughed up 4 lumps. Where's that coming from? It's from my tonsils. I know it's from my tonsils because I'm not coughing here. It's just coming from my throat. And so when I go home, I do oil pulling, which is coconut oil in the mouth, swishing around 10 times and then release it out, either in you call it a trash can, or you don't call it plug hole. Don't put it down the plug hole, the sink, you call it sinkhole, because coconut oil, when it goes hard, what happens? Solid. Don't put it down the drain or you'll be in trouble. And often after that, there's a cough up, because what it's doing, the name's called oil pulling. It's coconut oil in the mouth and you swish and you're pulling waste from in the in the lungs, you're pulling waste from the tonsils, you're pulling waste from the sinuses, you're also pulling waste from the tongue, you're pulling waste from the glands under the tongue, waste is being pulled from the blood vessels under the tongue. That's why it's called oil pulling. And Bruce Fife, F-I-F-E, he's written a whole book on it. One wonders how he could write a whole book on oil pulling, but he has. And he shows that just this simple thing, I've only known about it for about 10 years, but apparently it's been quite common all through Asia, is oil pulling as a way, a simple little way of just pulling waste out of these areas. So if you have a cold, if you have a sinus, if you have any chest, a part of what you do to the body to bring about healing can be oil pulling. Now, because I travel a lot and sometimes I'm not breathing in the breast air, especially when I'm on planes a lot, I regularly oil pull. And I'm amazed when I oil pull that I'll often cough up a lump. And you know what I think? If I didn't oil pull, where would that lump stay? And if I didn't go up the big hills and down in the morning and I didn't cough up that lump, where would it stay? Well, I'd have to get more of a cold. Because that's what a cold is. It's a house clean. And if you give the body the right conditions when the house clean comes, it can actually go through your body very quickly, maybe in a couple of days, and you'll be right. But one of the reasons why people get excess mucus in the respiratory areas is because of an allergy. And that allergy could be to exposure to chemicals, it could be exposure to mold. Check your house. There can't be any mold in your house. It's a toxin. And it can also be an allergy to food. So it's a matter of putting the detective hat on and finding out, now, why do I have all this mucus? Now, if someone's got a cold, they're going to have mucus. And if someone had a cold and it went to the chest, they'd probably cough for 3 weeks. That's usual. One lady said, my little one's been coughing for 2 weeks. I'll say, yeah, that's usual. That's usual. So let the body do its house clean. And rejoice every time a lump comes up. Where was it before it came up? It was in you. That's right. And so be cautious of exposure, especially if children are regularly getting tonsillitis, regularly getting colds. You've got to put the detective hat on. Maybe a cold or 2 a year. Children get a lot more colds than adults because that is boosting their immune system. And one of the best things you can get when you've got a cold is a fever. But let's go back now to look at why there might be irritation in the respiratory organs. It might be exposure to chemicals, it might be exposure to mold, or it might be exposure to certain foods. And so the 5 main allergen foods are dairy, and that's one of the first symptoms of an intolerance to dairy is excess mucus in the respiratory organs. Also, the hybridized wheat, we've discussed that a couple of times. The hybridization of the wheat in the 1950s produced structures in that wheat that are not known in nature. And some people with a cast iron stomach who don't eat it, all day, every day, they don't appear to be many symptoms. But one of the symptoms of an allergy to wheat is excess mucus. Oats is high in a plant chemical called lectins. I think you call it oatmeal. We call it oats in Australia. And lectins, if they get into the blood, they increase inflammation. So if someone has an allergy of any type, they're best eliminating the oats. Once the allergen's been, or the allergy symptoms have gone and everything's settled back to normal, maybe they can have a little bit. You'll quickly see. If they have the oats and then the mucus appears, what's the body saying? No, go to millet, go to rice, go to something else. Peanuts are commonly contaminated with mold. And so they're best kept away if there's an allergy. And refined sugar, basically it just is like kerosene on a fire with any sickness. So when I was at Misty Mountain a few years ago, we had a nurse who was an ear, nose and throat specialist nurse. So what she does, she assists the surgeons and the doctors that are treating sinus. So they do a lot of sinus operations to clear out the sinus. She said, you wouldn't believe the green slime that we pull out of sinuses. And she said, and every specialist acknowledge is that it's fungus. So then my question is, well, why is it there? And then I was reading, and I think I've quoted this in my book, that in the 1990s, a group of doctors in the Mayo Clinic declared through their research that sinus was fungus. So why is it there? That's what I want to know. Why is it there? Well, when you get someone that's got an allergy to these foods and there's common excess mucus building up in that area, then the microorganisms evolve into or change roles into a cleanup or cleanup team, you could call it. That's called yeast and fungus. That's what they do. They clean up the area. But because the allergens continue and the mucus continues, then the fungus, the yeast, have a continual food supply there. And so they go and get all of it cleaned out. And by the way, because they're having to breathe through their mouth, then the little canals at the back of their nose are getting smaller and smaller. And so then the next option is to have it drilled out. Ugh. Yes, it's true. It does happen. And sometimes it's blocked up so much it bends, and it's called a deviated septum. Let me tell you about an experiment. Poor old monkeys. They've had a lot of experiment on them, but one doctor, he blocked up monkeys' noses for 6 months. And a group of monkeys, noses blocked up for 6 months. Their whole facial structure changed. Their jaws dropped down, and they were miserable looking creatures. After 6 months, they unblocked the nose and taped the mouth up. I think they unblocked the mouth when they drank and ate, but most of the time, the whole structure changed again. But what they found with the blocking of the noses, so they weren't being used, the little canals at the back of the nose shrunk right up, and even skin grew across those little canals. So when they taped the mouth, so they had to breathe through their nose, it only took a couple of weeks and those little canals were open wide again. An illustration, if you don't use it, you lose it. And I have been stressing nose breathing this week, but the question then arises, well, why do people mouth breathe? People mouth breathe because their sinuses are blocked up. What's the next question? Why are they blocked up? Usually because of an allergy, because mucus is produced to protect those delicate linings of the nasal passages back of the throat. It's a protection. So what's it being protected against? Protected against allergens. So again, it could be mold in the air, it could be chemicals in the air, or it could be foods, and the foods are a common one. Once those foods are stopped, it can take at least 2 months to see a response. So you can have a slice of bread, it'll be out of your body in 24 hours, I hope. But the effects can remain for sometimes up to 2 months. Some people stop for a month and see no effect, so they go back on them, but you've got to give it 2 months. And we've got so many options today. We've got almond milk, organic soy milk, coconut milk. People say, what milk do you drink, Barbara? I say, I don't drink any. I'm weaned. I eat food. Milk's for babies. But I do understand some people like to have a cereal or a hot drink with a bit of milk. And the simple needs bread or sourdough spelt bread. You've got Sprouts, Whole Foods. They've got quite a few bread options there. Oats for breakfast, you can have brown rice. That's nice in a slow cooker overnight, or millet in a slow cooker overnight. I've got grandchildren coming to stay in a couple of weeks, and I cook millet every morning. They love millet porridge. But you've got to put about 4 cups of water to 1 cup of millet to make it soft. Otherwise, it's dry. And they love it with some soy milk, a sliced banana, honey. Just love it. Goes a bit hard when it goes whole, but one of my grandsons, after lunch, he says, "Is there any millet?" And they just eat it cold with milk and honey. That's like a dessert to them. It's not quite mine. They like it. And peanuts, there's so many nuts. Peanuts are a legume, they're grown in the ground. If there's a grower around here somewhere who's grown the peanuts, harvested them, and you can buy them, those peanuts would be good. The problem is most peanuts are stored. And today is a typical day of what would cause the mold growth. Very cold, frosty morning. It was cold. In fact, Sylvia reckoned the water was even colder this morning. So it was a cold, frosty morning, and look at it now. Whew. If you're out there in the sun, I think you'd be taking your jumper off. So in a silo, what's happening? Moisture. Moisture is being built up, and that, of course, is conducive for mold growth. And there's so many options to the refined sugar. Honey, maple syrup, and palm sugars, they're all unrefined. So there's many options or alternatives to those allergies today. We've seen sinus clear up. We have seen tonsils shrink back down. We've seen respiratory problems clear up because of that. Is it safe to use nutritional yeast? I don't use it. I don't use it at all. You can't kill yeast. And there are so many people that I meet today who major or minor have some sort of yeast problem happening. Typical is the nails. They should look like that, look like a nail. One man was so excited about the change in his nails after changing his lifestyle, changing his diet, he sent me a photograph of his big toenail. And it was coming through perfectly clear, and the top was all lumpy and gnarly still. He was just so excited about his toenails. So nutritional yeast is not something that I use to make food taste magnificent. I use fresh herbs. So when I go to Holland, the people I stay with there, I always do the cooking. And in 1 week, I use up the herb supply that they use for a whole year. You got to put a lot of herbs in, and that makes it taste magnificent, and good quality salts and good quality oils. That's what makes food taste nice. You got to do something. And I think a lot of people that have come off eating and going over to vegetarianism, looking at the legumes, I mean, you cook a steak, you cook a chicken, it's just flavoursome. You cook lentils, no flavour. You got to do something. It's like tofu, it's a tasteless sponge. You got to do something. I put ginger and garlic and herbs and lemon and oil and salt, let it marinate for a couple of days. Amazing. I say, if your tofu doesn't taste nice, it's your fault for not putting enough flavour in it. Don't go lightly on the flavourings, you know. It gives a real nice punch. And so I'd like to give you a story of a lady that came to with sinus problem. It's quite an extreme story. She was 32. She was overweight. And she said, my main problems are sinus. She said, I have daily headaches. The pain is so much. So always mouth breather. Being a mouth breather, she's not getting oxygen into her cells. So you know what she's just been diagnosed with? Chronic fatigue syndrome. Can you see the diagnosis comes, but there's no assessment of why or what can be done about it? And I know in Australia with Medicare, the doctor's only allowed to spend 15 minutes with you. How much can you find out in 15 minutes? And that's why I believe each one of us should be our own doctor. We know our history. And it's important as being your own doctor is begin to document your case. Look at your childhood. Look at what happened there. And if your mother's still alive, ask about your birth. Were you vaccinated? Any drugs? Did the mother have drugs in pregnancy? Because all of this makes us who we are today. But we've got a very forgiving body. And I thank God every day that it's got an inbuilt ability to heal itself. And I think you'll agree with me, it bears long under abuse. But the day comes when it usually says, enough. And then they give that a name called disease. So this lady, when I looked at her diet, because she felt so miserable, she just grabbed the fast food, bread, cereal, pasta, 2-minute noodles. She didn't realise that she was feeding her problem. And so at Misty Mountain Health Retreat, we don't use any of these foods. And 2 days on juices, the body it gets clean pretty quickly. In fact, after the break, I'm going to look at the fast that we do at Misty Mountain, and we're going to be looking at the liver, the project manager who orchestrates it. Within 3 days, she was not getting headaches anymore, and we were getting her to get a herb. This is quite a remarkable herb. It's an expensive herb. We can't get it in Australia, so every time I come to America, my staff say, please bring some golden seal back with you. And when I get into Australia, we get it as the powder. So when I get into Australia, I have to declare everything, so I write herbs. Now, did you know in Sydney Airport, you can't fly in before 6 a.m. and you can't fly out after 11 p.m. So at 6 o'clock, you've got about 10 planes from all over the world all landing. So the Aussie immigration, they're moving you through quick. And they come up and say, what do you got, herbs? What are you going to do with the herbs? Make a herb tea, I'll go through. And we do make a herb tea with some golden seal. But what if you can get the golden seal powder? Golden seal is called king of tonics to all mucous membranes, and all your respiratory is lined with mucous membranes. So it has a tonic effect. But something else very interesting about golden seal, it's a huge or a broad range antimicrobial. It's antifungal, anti-yeast, antibacterial, anti-staphylococcic. Did you hear that? There's not a drug that will kill staph, golden staph, but this herb will. So we get people to sniff it. Now, did you know when you make a fist, you've got a little dip right there, and it's called the snuff dip. And they used to put snuff in there and you'd sniff it. Well, that's what you do with the golden seal powder. Sniff it up into the sinuses. Don't go, or it'll feel like the top of your head's about to blow off. Just little sniffs. Just do a little sniff with one side and a little sniff on the other. That's a very expensive herb, but you only need the slight little amount. So that's what we got this lady to do. Twice a day she would sniff up the golden seal. She said to me after a couple of days, she said, Barbara, it's like I'm blowing green barley out of my nose. And when she told me that, because we do give green barley, I thought maybe she breathed in the green barley, but you know what she was referring to. Remember what that is? Ear, nose and throat specialist nurse said, we pull green slime out of that nose. Well, that golden seal was loosening the build-up and she's blowing it out. Don't get scared when you blow out green slime. Rejoice. Where was it before you blew it out? So this lady went home a very happy lady. She had direction. She now knew which way to go. I didn't hear anything. 2 years later, a lady came to do our program. She said, you don't remember me, do you? I said, I'm trying. She was that lady. She'd lost 10 kilos, which is 20 pounds. She looked great. She said, I've got a great story for you. She said, I have had no headaches for 2 years. See, their headaches were due to the build-up in her sinuses. She said, I don't have sinus problems anymore. Yes, I did blow out green slime for about a month. She said, I have stopped all of those foods. She said, I'm now a nose breather. She was a mouth breather because it was just so blocked up. The best way, if you're blocked up, is to blow your nose. And if your mouth tries to open, tape it up. And you will, as you breathe through your nose, you will open the nostrils. That's the good news. Remarkable story. Now, what would have happened if she hadn't come to our retreat and learnt these ways? You know what Misty Mountain's called? Misty Mountain Lifestyle. It's not Lifestyle Centre anymore. It's Health and Education. Because our aim, my aim, is to teach you how to be your own doctor so that you go home and you do it. And as you do it, you do this. You listen. You listen, and sometimes the body will go, yay, and sometimes the body will go, oh, can you go a little bit lighter on the sniffing of the golden seal, please? So you'll feel your way. When I was in Peru 2 weeks ago, there was a lady that gave a testimony of her renewed health. She said, I was working in New York. She said, I was busy lifestyle, busy, hardly ate anything and just grabbed bits and pieces here and there. I started to get health problems. I went to Peru and went to a natural healer. And he said, well, when you eat this food, how do you feel? She said, I don't know. She had taken no notice. And when he said that to her, she was challenged. So she started to notice, how do I feel when I eat this? How do I feel when I eat that? How do I feel when I eat this? Do you notice? Have you ever been to a doctor who won't listen to you? It's very frustrating, isn't it? Don't be that doctor. Everyone's gone quiet. Learn to listen. Learn to listen. When my daughter Jessica lived in the rainforest with her new husband for a few years, I visited her once because we were still in Melbourne. She said, Mum, did you know that every set of rapids in the creek has a different sound? What's she been doing? Listening. How many people notice the sound of the rapid compared to the sound of that rapid? It's learning to listen. I must tell you, I've never really mastered the art of listening to the sounds of different rapids. But Jess had time. She had time on her hand to do it. So golden seal powder is an excellent snuff for the sinuses to help clear them out. And you can stop all these foods, but sometimes people have got 10, 20, 30 years of build-up in there. And so that's when we need to be this, patient. And in the book, The Ministry of Healing, it's about page 57, the writer says, nature's process of healing and upbuilding is gradual, and to the impatient it seems slow. Can you identify with that? I certainly can. I'm wanting this am to be better right now. It was 2.5 inches, now it's only 1 inch. It's getting there. And I want to wake up in the morning and that hand to be just like that hand, but it takes time. It takes time. Takes time. You've got to give it time. And there's a verse in the Bible that tells us this. It's found in Galatians 6, verse 9. It says, let us not be weary in well-doing, for in due season you will reap if you faint not. In other words, you will get the results if you don't give up. Just keep going. It might have taken 20 years to get this, but the good news is it won't take 20 years to undo, but it could take 1 or 2. It takes time. You got to give it time. So stopping the allergens is the first step, but there are also things that you can do. And believe it or not, nose breathing. I want to show you something else about nose breathing, and this can be particularly helpful for people who have breathing problems in the chest, particularly bronchitis or asthma.
Barbara shared valuable insights on how to naturally get rid of sinus issues without the need for invasive surgery. By incorporating these natural remedies and practices into your routine, you can find relief from sinus problems and improve your quality of life. Besides, Barbara also talks about nose breathing and the techniques that can help relieve sinus issues. Please like and subscribe to the channel, and don't forget to check out our other video on nose breathing that can further support your sinus health and overall well-being.